Welcome back. Now, gender-based violence within post-schooling education and training sectors remains a serious challenge. Despite some improvements in responding to incidents of GBV, more must be done to address patriarchy, gender equality, economic factors that lead to the transsexual nature of many relationships and other drivers of GBV. To address this, Higher Health convened a collaborative forum with other government departments. For more on what came out of that gathering, I'm joined by the Higher Health CEO, Professor Ramneek Ahluwalia. Thank you so much for your time, Prof. We do appreciate it. Perhaps just speak to us about why the decision was to host this kind of forum. I'm sure the answer is very obvious because of what we're seeing with GBV, especially in higher institutions. But maybe just tell us why the decision was taken to host this forum.
Good evening, Heidi, and thank you very much. Heidi, we're dealing with a very brutal pandemic, which is infused with crime. It's actually a criminal. It's an absolutely dealing with a multifaceted societal issue. We find ourselves with higher education, the microcosm of a bigger society at this moment. So I think this technical task team of the convening of the forum was to bring different government departments and sectors together. I mean, we as higher education will never be able to fight this epidemic of gender-based violence and femicide without South African Police Service, without National Prosecuting Authority, and without other civil society and government partners. So this is a very planned, collaborative effort, a proposition where we can all do our bits together. One sector in isolation with the other will not be able to win. Our government has passed a policy on gender-based violence, which is a departmental policy, which was launched in 2020. We are implementing the policy. We fail in the implementation many times. We made strides a lot by putting a number of guidelines, protocols, minimum standards, audits, checks. But still, we fail in multiple times. And that's why building more partnerships with South African Police Service, getting National Prosecuting Authority, interconnecting with the national registers, connecting ourselves to how do we make survivor-centric support towards building a good collaborative effort with South African Police Service, ensuring that justice prevails. More we will be able to give justice to the survivors, more this pandemic can come down. So I think these are multiple issues that we're trying to deal. And it's an extremely difficult pandemic. It's not like a COVID-19, you can get a vaccine and get over with it. It's generational, it's been through systems, got multiple causes, and we need to tackle each and every cause one by one.
So you speak about the fact that this is a pandemic, and you speak about the fact that this is systemic, it's generational, and I'm wondering if more should actually be done from a community level, a family level, but also a schooling level. So it's a very different environment. You're a completely different individual once you leave school and move into tertiary, and often we see this aggression and violence coming out on a tertiary level. Unfortunately, we are seeing a lot of it as well now in schooling. But don't you think that the conversation should also consider the fact that a lot of this happens at a very young age and not necessarily post-schooling?
So I think you're absolutely right. And one of the critical implementing part of our policy has been curriculums. We have actually launched a co-curriculum on gender, but not just gender. Tackling gender equality, toxic masculinity, patriarchy, and then gender-based violence, and then integrating with drugs and alcohol, other causes like HIV and other diseases that are very engulfed together with the gender problem or gender challenge that we have. And I think the aim was not only to bring every young South African in the post-school education only, but also to work with Department of Basic Education and start at least with the teachers, the life orientation teachers, and all the teachers in the schooling system, getting them, and actually giving an NQF level 5 higher certificate on gender alone. The aim is we believe education is empowerment. We've seen the difference. Last year alone, 200,000 students enrolled into the gender curriculum. And for the first time, we started seeing where we only got 200 cases reported of GBV. As much as we know, this is a huge pandemic, but the reporting is too minimal. We saw 6,000 plus young people coming out and reporting GBV. So this means breaking the silence is possible through education. And what we always say, education is prevention or education is empowerment, does make a difference. So I think peer-to-peer dialogues at high school level, in post-school and tertiary level, and appeal through you. And as a medium, I'm very grateful, Heidi, you've given us an opportunity, and also to eNCA, that we can speak to parents through you. They have a very critical role with us. We are a society born of single mothers. That's a reality we face. A society which has seen a lot of abuse at a young age. But the only way we can change is through this generation that's entering into the education system, post-school education. Can they form families? Can they be good citizens? And I think it goes beyond just the gender. We're trying to build civic values, putting civic education together. And I think if parents can come with us, the student governing bodies can come with us, we probably will make more strides into it, considering it's a societal pandemic. And it's very difficult if without them we can win this.
Certainly, and having covered multiple stories of women tragically losing their lives while studying or whatever it might have been, I can't even imagine what those families are going through, still trying to find closure, whatever it might be. Just lastly, Prof, I hear you speaking about dialogue and these forums, and we need to have these conversations, for example, also media coverage and speaking to parents. But what other solutions are we looking at here, other than just having a dialogue? Because at the end of the day, it's one thing to tell somebody that gender-based violence is bad and that you should not abuse, especially women and children, and kill them and rape them. And it's another thing to actually get somebody to understand that that is not something they should do. It's got a lot to do with upbringing as well.
If you have to tackle a disease, a challenge, an epidemic or a pandemic, we have to tackle the root causes, not just the problem. So what are the root causes of GBV? Staff-student relationships, patriarchy, toxic mentality, the issues of drugs and alcohol, and multiple other issues that remain connected to poverty and connected to unemployment and many other issues which form centers towards it. So I think we have to tackle these. So that's why protocols on campus safety and security that we have released in these forums with South African police and NP are critical, which forces our institutions to invest towards lighting, protection, visibility of security, ensuring our libraries and late evenings, escorting our students to safer places, protocols on our residences, this alcohol parties that happen on the weekends. How do we curtail outsiders coming in? What kind of level of drugs and alcohol we try to really enforce to close these loose ends that we have with our system, putting protocols on private accommodation, putting proper vetting services with private security that's working in our system, vetting our academics, connecting our national register, which is if there is academics who have violated or have been reported, they cannot join other institutions so that they are repeated offenders, and to stop them. When we go out on travels, we've seen a lot of student and staff when they go on campus travels, for research projects, a lot of gender-based violence happens in those areas. So, we need to tighten every loose end, at this moment. It's not costly that we can't do this. It requires a will, it requires a desire, it requires those minimum standards. We saved 6,500 lives last year, but we still failed in many other lives. The question is gradually, every day by day, we need to save more and more lives to a level that we go and control this epidemic right from its neck. And it will take time, and it's a challenge.
Definitely, but those 6,500 lives, it is some progress, and hopefully this year it will be even more because every life matters. Thank you so much for the work that you do, and thank you for speaking to us. That was Higher Health CEO, Professor Ramneek Ahluwalia.